Our project Prompt Care really involves a very broad range of disciplines, so that at any point in your cancer journey, patients' psychosocial well-being, their physical well-being is going to be treated and looked at in the same kind of way that an X-ray is going to be viewed, a blood test, for example, is going to be viewed. So it's putting it on the same level and on the same platform where their healthcare providers and their cancer care team can access that information readily in real time when the patient is sitting there with them in their appointment. We've really developed the infrastructure to be able to collect patient-reported outcomes from patients online. We're able to report that information in real time to their healthcare providers, and we're able to send patients links to self-management resources to help them manage their issues from home. Whatever cancer type you have, we've been able to engage those patients in prompt care, and also covering patients not just on treatment, but also into long-term survivorship. So it's really saying, how can we target care to the patients who need it most at the time that they need it?
The Prompt Care project is very important because it collects patient-reported outcomes. It not just collects them, but it integrates them into the medical record, right in the clinic, right in front of the eyes of clinicians who can use them to assess their patients. And we have very good evidence that this approach not just improves people's well-being, but actually improves their survival, their outcomes from cancer.
We've been able to break that ground in Australia, but if we're thinking internationally, it's really quite groundbreaking internationally as well. By keeping people out of emergency departments, by addressing their needs and well-being and symptoms in a much more timely manner, basically only having them come into the system where it's required. So that's really a very big deal on an international level as well. We've got a really very broad range of different disciplines. We wanted to make sure that it was the right person providing the right care at the right time. But importantly, we've also involved in our discussions policy makers and decision makers who are then able to inform how we take this from a system and implement it as part of routine care. And that's really been quite critical as well. And I think that's been one of the advantages of being part of the partnership, in that all of those different disciplines come on board through the partnership in a very effective way.
The value of the partnership to the Cancer Clinical Academic Group is that it brings together two of the large translational cancer research networks, CONCERT in southwest Sydney and the Translational Cancer Network in southeast Sydney, to value add, but there's a lot that we can learn from each other. So the aim of the Cancer Clinical Academic Group is to value add, to link those two groups together to give us a much greater economies of scale. Where we've got a successful intervention in one area, we want to make sure that everybody has access to it across the whole of the partnership. The footprint of Maridulu, Budyari, Gumal is very large. It covers nearly 1.5 million people. More importantly, it covers a very diverse population. And in southwest Sydney, for example, about half of all people who live in southwest Sydney speak a language other than English at home.
We've developed a system that works well for English-speaking patients, but we now need to think about how we adapt it to include all cancer patients. We need to find ways of better understanding what the issues of concern are for those populations in a very systematic way. So any research that we do in our area will actually be applicable internationally, and will be able to inform how we provide better care for cancer patients of non-English speaking backgrounds internationally, not just on our local stage.
We know that for all areas of medicine, there's quite a lot of variation in practice. In cancer, we know that that variation in practice ends up costing us money, and more importantly, ends up costing lives, because that variation in outcomes that we see is driven by variation in practice. So if we can improve practice, apply basically the best things that we know now to everybody with a problem, then we can improve their outcomes, the quality of life and their survival.
The project Prompt Care is absolutely scalable. In fact, we've been working with the Cancer Institute New South Wales along with Bupa Health Foundation on their statewide rollout. So they are actually putting significant resources into developing a program that can be rolled out statewide, which is modelled on Prompt Care. But we can't stop here. We want to build a system where every single cancer patient is part of that system, so that everyone who comes in for treatment is able to start on Prompt Care and be able to report their outcomes to us essentially forevermore.
There really is no point in doing anything small. There are lots of people doing small projects, small grants. If we're really going to make a big difference, if we're going to do something scalable, we have to think big.